Hello, Dr. Venkatesh. It's lovely to have you at the 8th edition of the CAHOCON event at the Bishwa Bangla Convention Center in Kolkata itself. So, you being one of the patron at CAHO and also the current chairman of the Indian Society for Lead Awareness and Research.
That's right.
Led awareness and research. So, my first question would be, can you discuss the journey of CAHO from its inception to its current status as a leading body in the Indian healthcare industry?
Sure. Thank you, Sanjana. Thanks to all the viewers. When you would like to know more about CAHO from the day of inception, it was 11 years ago, 2013. CAHO started in a very small way. The reason why CAHO started, to bring all the affiliated hospitals together so that their needs are understood and convert to accreditation body, because the individual hospital may not go. As an organization, to help the accredited healthcare organization, hospitals, this CAHO was formed. Then CAHO had a very good relationship. It still has a very good with NABH. Now, we always say, think globally, act locally. But CAHO is little different. What it practices locally advocates globally. All good practices of hospitals, laboratories, the CAHO has several verticals. Two important verticals. One is hospital, another is a laboratory, diagnostic laboratory. So what good practices are there, it has to be taken international. That's why CAHO launched international programs. One more thing in CAHO, which is highly appreciable. As a patron, I'm very proud of CAHO. That is, CAHO brings like-minded people on one platform. Connects people who have ideas and thoughts. Ideas. Another doctor has certain ideas we have not met. We can share these ideas. This is on the CAHO platform. CAHO is not just organizing meeting once in a year, like many professional bodies. Every day, every week, every month, something is going on, which is which I have not seen in any organization anywhere in the world. Yes. With the CAHO. I have seen there's an increasing awareness amongst healthcare professionals on the need for quality service. See, everybody who is attending this, when they go back, their mental makeup, mental setup will be different. They would like to be better tomorrow. That is the gift given by CAHO to all the delegates who are attending this conference. Look at this organization, this conference. Is it biochemistry conference? No. Pathology conference? No. Pediatricians conference? No. Gynecologist conference? No. But I would say yes for all this. Because people from different disciplines, nurses, paramedicals, laboratory people, then super specialists from small, medium, large hospital, they're all attending this. That means not only these medical professionals, even supporting professionals like hospital administrators with healthcare qualifications, they are also part of this. It is an ocean of like-minded people who are all trying to make healthcare better for a common man. CAHO is a common man's organization, because without their knowledge, CAHO is making their healthcare better. CAHO is looking at three important things as far as patients are concerned. Number one, patient safety. Number two, patients' needs, patients' rights. Patients' comfort. Any patient would be comfortable in a hospital. Any patient who is undergoing some procedure should be ensured safety. Patient should know what are my rights. These are the three things which are discussed in every platform of CAHO. And this is what we need. And I also would like to tell you today is a very important day, 7th of April. Not many people are aware. All over the world, 7th of April is here. The way as a slogan. My health is my right. If everybody says my health is my right, this is the World Patients Day. This is this year's slogan. That means CAHO is helping everybody. What are your rights? Are you getting it? This is your right. We, you are healthy. We don't want you to become patient. But 3 days ago, when I was addressing a gathering of 300-400 people, I said I'm a little confused to either call you ladies and gentlemen or doctors. I'm a little confused. I can only address you, my dear patients, because if anybody here who was never a patient in the past, who had not taken any medicine in the past, raise your hand. Nobody raised their hand?
Yes, folks about is that.
Okay. Is there anybody who will not fall sick from now onwards? Who will not take any medicine from now onwards? Nobody raised their hand. That means all of us, including me, you, belong to that category of patients. Therefore, what CAHO is doing is a patient-centered activity, not doctor-centered activity. It's a patient-centered activity. Every time what we discuss is in the interest of the patient. This is the beauty of
Yes.
where you have multidisciplinary people, multidisciplinary approach, local implementation, global transformation. We see a lot of outsiders have come to learn from us, to carry our message back to their country. That is the beauty of Star.
So sorry about it.
Thank you, sir. It was lovely to hear such, such insightful parts of CAHO. We really weren't aware of it before. So my next question would be, what were some of the early challenges faced by CAHO during its inception, and how were they addressed a strong foundation for the organization growth and success?
It's to God, I'm not
In the past,
just like what
when we first few years,
you go on some of that was
there were so many organizations.
person.
People knew those organizations. They did not know CAHO.
Or
For CAHO to become visible, CAHO had to do something very, very special what others were not doing. What is that? Catch them young. Get young professionals. Invite them. Encourage them. Empower them. For example, today the Secretary General of CAHO, Dr. Lalu Joseph, was like anybody like you. Today, look at her. She is the leader. Not only leader in India, global leader. Almost everyone in CAHO, if you take their average age, maybe 35, 40 years. Only some of us are old. Majority of them are youngsters. CAHO did a wonderful thing to capture the quality commitment by involving youngsters, younger generation. That's what I guess. They caught them young. That has made this organization very stable. If you see Shankar, Sen Gupta, who organizing secretary, I could not even believe that he would do this.
those way from them.
He was a shy,
So there's
and now he is a leader. He has so much of confidence. He, his wife, Ashwini, look at them. I know them for last 25 years. But I'm very proud of our CAHO members who have helped CAHO to get over the initial, what is it called, delay in growth. But now the growth is very fast, exponential growth. And membership fees is 500 rupees, nothing, 2 cups of tea in some hotel. CAHO has helped people from the healthcare, especially from the junior level, to become members. I tell you, CAHO is a university by itself. CAHO is an institution by itself. CAHO is the library by itself. CAHO is the biggest laboratory to nurture young brains by itself.
Where did it?
Thank you, sir. It was lovely to have you here at this event, and we really want CAHO to grow more and more so that we can, be a part of this lovely event. Thank you, sir, so much.